this is Roger Green, host of the Surfing the NASH Tsunami podcast. This weekend, we are offering 5 conversations from episode 13, our preview of the upcoming Innovations in NAFLD Care Conference in Barcelona. And from the vault, we have conversation 24.4 from season 3, the last part of our wrap-up episode from the inaugural INCBCN conference last May. It's interesting to review what Jeff Lazarus and Jörn Schattenberg anticipated then as compared to what we discussed in previewing this year's conference. This conversation starts with Jörn Schattenberg describing the meeting as being positioned as the meeting that integrates non-hepatological views of fatty liver disease. He describes inputs from endocrinologists and a paper from his group showing high levels of advanced liver stiffness in the general population. These should provide opportunity, he feels, for multi-specialty understanding. In that spirit, I recall Hannah Mamuszka's comments from the previous week, which is season 4, episode 12, on strong links between fatty liver disease and not only hepatocellular carcinoma, but the entire range of obesity-related cancers. I asked whether the first morning's epidemiology talk will cover this. Jeff Lazarus suggests that it will and that there will be considerable focus on cancer throughout the day. At this point, Jörn asks Louise Campbell about liver screening by discussing the same links between liver and cancer once again. Louise describes herself as, and I quote, excited already, unquote, to hear the entire discussion framed around liver health, since she left the NHS in the UK 5 years ago with the idea of focusing on liver health, not disease, as her mission. She notes that the majority of her scans today come from members of the public who are surprised to learn of the health challenges presented by fatty liver. She sees this event, and really all integrated thinking and writing, as an opportunity to educate on this point, the importance of getting your liver healthy before disease sets in, or maintaining liver health in the first place. She returns to the idea that NAFLD can lead to cancer without proceeding to cirrhosis, and the accompanying idea, again, that liver health matters. This, she hopes, will educate primary care physicians, as do recent recommendations from the American Heart and American Diabetes Association. The inaugural INCBCN conference was a truly innovative meeting concept that produced fantastic discussions, lessons, and insights. These conversations can tell you what to anticipate this year, so just sit back, listen, enjoy, learn, and when you're done, join the dialogue on our LinkedIn discussion group.
Jörn Schattenberg.
Roger, you asked what's special about day or what's the overarching theme. Again, I think as INCBCN is positioned in the field of NASH education as the meeting to have non-hepatologists and outside practitioners involved, allied health professionals, and people that are not thinking about NASH every day. We start, as Jeff said, with a fatal triple and aspects that augment the disease, and then we go to the endocrinologists to really get their view and perspective, because that's a lot of these disease or these patients with advanced disease stage are. We're going to be presenting an abstract from my group showing that elevated liver stiffness is up to 10% in patients, in the range be above 15 kilopascals. So really advanced liver disease. And a lot of endocrinologists are not aware. So this is where we want to pull them together and start the discussion. We have lectures, but really the baseline or the theme of INCBCN is that we start to discuss and develop something together. And one output of this of last year's was, of course, a publication Jeff and I led and all the members of the steering committee contributed to. So this is really something where we get to interact with our peers, even outside of hepatology.
Fantastic. Jörn and Louise, I don't remember if it was our episode last week where somebody was talking, it was Hannah last week talking about it being underappreciated the degree to which all the obesogenic cancers are related to fatty liver disease. She said, we all talk about hepatocellular, but we don't talk about all the other obesogenic related cancers. I'm not familiar with Harriet's article, Jeff, but I'm wondering if that's something that you will be touching on or not, and if there's a way to get there from here, if you want it.
Jeff McIntyre.
Absolutely. I mean, part of the reason for her to talk about cancer was to remind us that, we're not operating in isolation, and there's a lot of risk factors for cancer. So when fatty liver disease is a risk cancer for liver cancer, it's compounded by all of the risk factors for fatty liver disease. So we really need to be starting to look at this much more holistically. So I think it's nice to have this this day of alcohol and liver cancer and diabetes. It's going to be a lot of fun in Barcelona.
Let's ask Louise, because she's doing a lot of non-invasive testing of these patients. And I think she scans patients that are increased risk of cancer. We're discussing a lot of advanced fibrosis that might not be a standalone disease, but those patients go on to develop cancer, liver cancer or colorectal cancer, breast cancer. We see more prostate cancer in males. We haven't generated all the data yet, but I know that we're looking at high risk populations. Now you can say this is, of course, the multi and comorbidity of these patients, adding genetic risks, adding lifestyle. But we have simple tests looking at liver health. And the liver unhealthy people have more events in that arena. So it can be one view that we, by looking at the liver, empowering the patients, educating them on their individual risk, we really do something in terms of cancer prevention.
Louise Campbell.
I think I'm excited already to hear what Jeff was talking about and the way it's been framed around liver health. That, to me, is the key. That's one of the reasons I left mainstream healthcare to look at early detection and monitoring. And although, yes, I do see patients with liver disease and known liver disease that come and get more regular fibrous scans than healthcare can provide them for their own well-being. But I actually deal with the majority of what we see as members of the public who did not know they had a risk. The whole aspect that was exciting about listening to Jeff there is if we use the premise of liver health, then looking early becomes a screening opportunity for metabolic disease. It becomes an opportunity to educate. It becomes an opportunity to locate those early cancers due to NAFLD, because NAFLD is also one of the few liver cancers where you do not need cirrhosis to get primary liver cancer. So by looking early, it changes that dynamic of purely looking for fibrosis, which is what FibroScan was initially designed to do. Our ability to now just look or discuss liver health as a way to look at prevention support of clients or people. The way we go about it is we educate people who already have a risk factor that they should be asking for liver health monitoring. So driving it to the GP, I've noticed that I'm pre-diabetic. What's my liver health? Or I've been told I've got fatty liver disease on a previous ultrasound. Can you check for my liver health? And I believe I'm also supposed to have a 2-year cardiac review. These things that get done, because that helps educate primary care physicians. And I think the one thing that's exciting, given the agenda that I've seen or just heard Jeff and Jörn talk about, since the conference last year and the meeting, the American Heart Association have added liver health to their recommendations for people with heart disease. The American Association of Diabetes have added to their standards of care looking for NAFLD and NASH. This is a perfect meeting following both of those organizations, increasing awareness to have this meeting now with the people around that table. But yeah, the majority of what I do is look at normal people now, driving them into healthcare and making them change their lifestyle early so they don't get, hopefully, liver disease. But I'm excited by what's been said on day one already.
So let me agree with you from a slightly different perspective. I think someone on a recent episode of this podcast or the other one made the comment that endocrinologists are now treating liver cancer, because if 70% of your diabetic patients have NAFLD, and if NAFLD elevates the risk of HCC, forgetting about anything else, then in fact, every time you treat a diabetic patient, you need to think about what you're doing in the context of avoiding cancer, in addition to everything else you're talking about. And he had never thought about himself as being in cancer prevention before, overtly, but now he got it. And so I think by the way you're juxtaposing this, and then Jeff, frankly, having, as you point out, the cancer speech coming first and then the endocrinologist coming later, that's an excellent way to draw that linkage. And it's a linkage that's not drawn often enough or loudly enough. So that's great.
And just to say something in addition to day one, you started at, I think, at the program we have on the website in the program section at around noon. So as a pre-event, starting in the morning, we have something we call the NASH NIT's Real World Evidence Summit, which speaks to a more hands-on training in which biomarkers do we use, how can we implement, these aspects you mentioned, which test could be used even outside of hepatology clinics. And here the experience is aimed at people that don't do these tests every day, to get them more familiar with the type of tests we advocate to screen for fatty liver disease and advanced fibrosis.
Jörn, do you anticipate that audience will be primarily local, or that there will be guests coming into the meeting from other locations that also need that kind of training and support?
We specifically reached out to get endocrinologists involved and colleagues from diabetes practices to participate, and we're continuing to invite them because I think it'll be a great experience. We're going to have some hands-on training and some lectures also as a discussion and question and answer opportunities. So it will be locals, but there is some people traveling and participating for that.
And now, back to Roger.
We hope you've enjoyed this recording. If you have any questions or comments about the content of this conversation or the entire episode, please put them in the review section of the page from which you downloaded this conversation, or send an email to questions@surfingnash.com. Next week, we may post our episode on Thursday to accommodate Jörn Schattenberg's schedule, returning from 2 major events in California in the presence of a strike in Germany. We've not locked down the topic yet, but the 2 we are considering are both quite important. Until then, stay safe, surf on. See you next week on the podcast. Bye-bye now.